Welcome back to SCV Today. Now, last week, if you'll recall, Tammy Edwards and I, we went to Dr. Craig Ingber's office, and Tammy was going to have Botox injections.
And I was horrified.
Yeah.
I was absolutely horrified.
Yeah. She was frightened.
I'm so glad you were there.
And my hands, I think, are just now coming back to life because she was grabbing them and holding them so hard. So I'm just getting the feeling back in them. Let's go and show you this entire segment, let's call it, with Tammy at Dr. Craig Ingber's office. So we're here with Dr. Craig Ingber, and Tammy's about to have her procedure done. And first of all, Dr. Ingber, what would be good to do is, can you explain a little bit about the whole process when we come walking in up to the point where you're about to start the procedure?
Sure. Well, Tammy would have either been self-referred or told to come in by one of her friends. That's the usual situation. Mm-hmm. And in her case, her main concern were the lines in her forehead and around the corners of her eyes, the crow's feet, and in the glabella, which a lot of people call frown lines or 11s. So that was her concern, and we would go over all that in the consult room.
Don't shake your head yes.
No, yeah, that's a concern.
It's a concern. It's a concern of
it
Dave's
is a
too.
concern. It's actually a major concern because she has what we call static lines. Even at rest, you can see these multiple wrinkles in her forehead and some coming from the corner of her eye, the crow's feet. She even has half of the 11s, so she has a 1 here. And that's significant because Botox or Dysport, which are the two products we use for this, are best used actually prophylactically before you get static lines.
Meaning?
So a lot of people come in and and people say, wow, aren't you here too early? You don't even have any wrinkles. The answer is no. A lot of people realize that when they're squinting a lot or they're frowning a lot or concentrating a lot during their day and their job, and they're feeling it here. They even get a little bit of a headache here. Mm-hmm. And that's the perfect time to come in. Because like I said, if these lines get too deep or these lines or these, can't promise they'll go away. Mm-hmm. They will always soften. And as long as there's Botox on board, they won't get deeper.
So you always start off with a consultation and talking about what those issues are. Then you take pictures.
Correct. And we take pictures to document what the state is before the procedure. And there are some patients who will come back and say, geez, this didn't work at all. And we have pictures to show that maybe it didn't. Mm-hmm. And if it didn't, we'd take measures to correct that. But more often than not, it was the patient's misconception of what was going to occur. As we talked to Tammy earlier, for instance, in the forehead, I don't like to completely paralyze the forehead so that there's no motion. I like it so that she can still raise her eyebrows. But I would like to do is get this area in here completely smooth at rest and even smooth when she raises her eyebrows. Of course, if she does raise her eyebrows, and we allow her to, she'll have a few lines out here, but most people don't mind that, to be able to show expression.
Sure. Mm-hmm. Who would be your typical client, typical patient?
Tammy. Really, the number one age that sits in this chair probably is a 42-year-old female.
She's 41.
Close enough.
So I look 42.
Ah.
But I'll look 18 when we're done.
We do have women in their 20s, and I had an 88-year-old patient in here yesterday.
Mostly women?
95%. 95%. So.
Okay, so you have already looked at her and made an assessment. You've talked with her. We've taken some pictures. Right. What's next?
What's next is to start the procedure. And there's two products available, Botox and Dysport. They're very similar, and usually what I suggest is whichever one has a discount or a deal going on, that's the best one to use. Right now, neither one of them does, so we'll go with Botox only because everybody's heard the name.
So this is a simple thing. Are you ready for this?
I'm ready.
Yeah? Let's start.
So this is perfect for anyone who's horrified of needles like I am. This is great for them to see that we can do it. We're not destined to have wrinkles for the rest of our lives.
True. And it's virtually painless. So what we're going to do is we're going to start off with a
Virtually.
practically painless.
Yes.
Yeah. Let's put it this way. Dave and I will feel nothing.
We will be back.
Okay. Take that away. Chin up.
Keep your eyes closed.
Face me. Right. Now, the first thing is you do have to frown. So give me a frown. Perfect. And relax it. And here we go.
So right now, what you're doing is injecting into a muscle.
Correct. And that muscle, if anyone cares, is called the procerus muscle. And when that muscle contracts, it contracts this way, which pulls things down.
Creates that frown.
Right.
Those 11s that you talked
Right.
about.
And
between
the
eyes.
other muscles we're now going to go after are called the corrugators, and they come up like wings, and they push together, which also causes those 11s.
So your whole objective here is to paralyze those muscles, but
Exactly.
it's not going to give her droopy face or a frozen face or anything like that.
Hopefully not. Actually, this little maneuver, because the
That's funny.
okay, frown again and relax. 1, 2, 3. So, if she could frown for you well, I'll show you something while we're waiting. Watch her eyebrow right here. Frown again. See what happens? Her eyebrow in the middle goes down and in when she
Right.
frowns. Relax.
Right.
So if I relax that muscle while we're trying to get rid of these, her eyebrow is actually going to come up a little there, which is a nice side effect.
Dave, I have to tell you, I can't even feel this.
Put the ice pack up so we can continue saying that.
Okay.
The numbing, what you're doing, that's just of the skin only. Is that right? Or
Well,
what are you?
it actually numbs pretty deeply, but the two purposes of the ice are, number one, numbing. Actually, there's three. Number two, diversion, because it does sting a little, probably stings more than the needle. And number three, it shrinks the smallest of the vessels, which cuts down the chance of bruising.
Makes sense.
Yeah, a lot of people are afraid of, and like I said, I can't tell you that people haven't sat in this chair and told me they've been injected by other people, and it was really painful. So,
No, pain is nothing. The pain is nothing.
You mentioned before that you had a friend who was here, and she said that the ice on the face was worse than the injection
Right.
itself.
Switch
Are you
again,
finding
Dave?
that the same?
Absolutely, 100%.
Yeah.
100%. So I should be back in 4 months, 3-4 months for my next
right,
one?
and when I say, let's put it this way, when we say you're a 4-month person, what that means is in 3.5 months, you're going to start moving these muscles again if you try. But if we got rid of the lines, they'll still be gone, although you can start to move. By 4 months, the lines may be back, in which case you want to come in, but if we check the pictures, you still wouldn't have forward movement. It's actually working better than you think, but at that point you want to do it. And that's a good idea. Once the lines come back, if they go away, that's when you should go in. Not when you can
And I
first start
won't see
moving.
results right away. It's going to take.
There are people that the next day they can see some results in their forehead, but I tell people I won't reevaluate them for 7 days.
Okay,
Because it can
perfect.
take 7. Some people 10, but 99% of people, 7 days, you have a full effect.
And the total time where you're here, maybe 20 minutes. From the time you go in
Yeah.
for a consultation to pictures to come in here to have a
Right.
procedure,
And
maybe
if
20
and the
minutes.
next time she comes back, this will all be drawn up by my medical assistant, and this becomes a 5-minute procedure.
Wow.
Unless we talk about her last vacation, or mine, or our kids.
Yeah.
Well, you
Different
are
story.
amazing, and you have done something that I thought I would never do, and that was get Botox. So
Yeah. And you did fine.
I did.
did.
I did
You
fantastic.
were a rock star. no
You're
doubt
so
about
happy
it.
with yourself.
That's
You were a little worried, but you're
No, I mean literally the pain was virtually painless. Really, the ice was worse.
right.
There you
Right.
go.
Thank you so much.
Perfect.
Dr.
You're welcome. My
Craig,
pleasure.
Dr. Craig Angber, ING.
BER.
That's right.
Yeah.
Correct. You did
Thanks.
great. You were fab.
And now the after.
Check it out. Look at my forehead. It's like a baby's butt. It's amazing. Like seriously, it's incredible.
Right now, all I can think about is a baby's butt. I'm trying to sit there and mentally picture the comparison.
No, Dave.
seriously,
Okay,
it's
you
good.
know I was horrified,
Yeah.
and I can honestly tell you, I am so happy.
Yeah.
I am so happy that I did this. First of all, there was like zero pain.
Right.
I mean, it was like the pain was nothing, really. This needle was so little. And with the ice, it really numbs it.
Right.
The ice is worse than the needle. And I just didn't realize how bad my forehead had gotten. And I mean, just at the golf tournament, I was in the bathroom washing my hands, and a friend of mine says, "There's something different about you." What? She's like, you look really good. Like,
And
what
you-
did you do?
And I have to assume that inside you're sitting there going, this is awesome.
I am. And I was with my daughters at dinner, and like Juliet was like, "Mom, you look really pretty." Like, and Juliet and Lindsay's, of course, she's like, "Yeah, Mom, you were really showing your age there."
Ouch.
She's like, "You needed to have something done."
Ouch.
She's like, "Your face was starting to droop," and so, you know, it's
Well,
I'm.
It looks
ecstatic.
fantastic. It looks
I'm
fantastic.
ecstatic. I am. Dr. Ingber,
Right.
patient for life, right here. Honestly, I literally will go to him forever.
And the thing that I come away with from that time is he was very patient, very calm, he explained everything and quite a bit. Went through a lot of detail in that introductory meeting and really talked to you about things. I was very impressed with the entire
Well, this
way
is
it
what I
worked.
really, really like about is he was a plastic surgeon for many years, so he really knows the muscle, the bone, he knows the structure. Because one of the main things I was really scared about Botox was somebody, doing the wrong area in my face, because I've seen really bad Botox, and I was scared. I would rather have wrinkles but have my face look normal than this man is a true professional, top notch, amazing.
And being the frugal guy that you like to point out that I am, I have to admit, I think it's very affordable. When he told us the cost, I was like, that's really not that bad.
It's worth it. So are you gonna get some here?
I have what do I have? Do I have, what did he call it, the 11s? Do I have 11s up there, the 2 up there?
Yeah. I think you should do it, Dave. I mean, you're on TV. I think you should do it. You can write it off. It's an expense. Seriously.
I hear you, Morris. I hear you laughing back there.
Seriously.
You frighten
Hey,
me.
Dr. Ingber, we'll talk, because Dave needs to get that taken care of. So,
Coming up on the program as we're moving on.
and I want to point out, Dr. Ingber is with Dermacure.
Dermacure, that's right.
Yeah.
That's right.
Oh, I will put his information on the website.
Yeah, go to our website, scvtoday.com. We can always get you all that information. When we come back, Michelle Sathey is going to be on the program. This is always a tongue twister. I practiced this. I did very well with it last night. Rock, walk, and wag. That's it. And when we get a shot of her right now, you'll see she has a little friend who's going to be on with us. Look at this little guy.
So sweet.